Now, vestibulocochlear nerve, the eighth cranial nerve. The vestibulocochlear nerve, auditory vestibular nerve, known as the eighth cranial nerve, it transmits sounds and equilibrium, balance, information from the inner ear to the brain. It is comprised of two parts, vestibular and cochlear. Vestibular and cochlear, responsible for hearing. This supply the cochlea, هذا vestibular ganglia. It has two branches. The way of examining the vestibulocochlear nerve is by examining the hearing sense, and to assess the hearing sense roughly by comparing two ears for simple sounds. مثلا صوت مال ساعة, click of hand watch, أو تحرك بصابعك شوف يسمع on each ear perfectly or not. That is a rough method to examine for hearing sense, or if you want to be more precise you have to use the Rini test and Weber test اللي أخذتوها by using a tuning fork 521 Hz. هذا هو الويبر تيست, وهذا هو الريني تيست using both air conduction and bone conduction, almastoid bone, and you have to compare both eyes. We have either Weber test or Rini test to examination for the hearing sense regarding examination of the eighth cranial nerve. Also مثل ما قلنا third, fourth and sixth facial مهم, أيضا glossopharyngeal and vagus nerve, very important nerve during examination, because those two nerves are commonly affected and commonly paralyzed in patients with stroke or CVA. فيصير عندهم مرات nasal regurgitation, try to avoid drinking or eating the patient forcefully, especially in those with stroke, elderly, because it may lead to regurgitation. فيخرج الفluid water from the nose, regurgitation, or even aspiration. ممكن يسوي لنا أيضا aspiration type of pneumonia. Glossopharyngeal or 9th and 10th cranial nerve, these two nerves are considered together because they exist from the brain stem side by side, and have similar and frequently side by side and overlapping functional and anatomical distribution in the periphery. Also, these nerves connect with many of the same brainstem nuclei and are often damaged together. من تأثر السوية. Glossopharyngeal nerve is mainly a sensory nerve, sensation. Glossopharyngeal nerve supply the sensation, including the taste of the posterior 1/3 of the tongue. It also supplies the sensation to the back of the oral cavity and the oropharynx. Vagus nerve هو التائه, wandering nerve. It goes all the way to the abdomen. The vagus nerve is provide parasympathetic supply to organ throughout the thorax and upper abdomen. It also gives sensory and motor supply to the pharynx and larynx. إذن glossopharyngeal nerve, 9th cranial nerve and 10th cranial nerve are examined together. هذا هو يعني few points about the anatomy of the glossopharyngeal nerve. This is the glossopharyngeal nerve, and this is the vagus nerve. This is the vagus nerve, and how it arises from the brainstem, supply the posterior 1/3 of the tongue, and supply the sensation of the posterior pharyngeal wall, pharynx, sensation. During examination of 9th and 10th cranial nerve, you have to ask the patient for any history of dysarthria or dysphagia or nasal quality. طبعا إذا عند البيشنت nasal speech, إذا عند 9th and 10th cranial nerve involvement راح يصير عندهم nasal speech quality weakness, especially those patients مثل ما قلنا عندهم myasthenia gravis أو عندهم muscular dystrophy أو عند 9th and 10th cranial nerve stroke مثلا أو CVS عندهم nasal speech quality. Number 2, you have to look for the uvula. Ask the patient to open his mouth وتقول له قول فراح يشوف البالاتال movement of the palatal wall، ونشوف اليوفيولا should be central والبالاتال movement يصعد وينزل very clearly. إذا عندنا 9th and 10th cranial nerve involvement راح نشوف اليوفيولا is not central, deviated to the or pointed to the affected side, and usually there's failure of movement of the palatal wall. You have to do the gag reflex by using a tongue depressor, wooden tongue depressor. فإف gag reflex is present معناته 9th and 10th is perfect. إذا عندنا impairment of the gag reflex معناته عندنا 9th and 10th cranial nerve involvement. Examination for touch sensation of the posterior pharyngeal wall نفسها هي هاي الخشبة اللي استخدمناها بالgag reflex الtongue depressor، نقدر نكسرها ونسوي لها فد pointed wood stick pointed and touching the posterior pharyngeal wall، ونشوف المريض يحس بالsensation of the posterior pharyngeal wall or not, because the glossopharyngeal nerve supplies the posterior third of the tongue as well, so you have to examine the sensation of the posterior third of the tongue and the sensation of the pharyngeal wall, posterior pharyngeal wall. This is the way. Open the mouth, say وشوف اليوفيلا and movement of the palatal wall. شوف هنا من عندنا failure of movement, failure to rise، هذا هنا اكو عندنا left sided glossopharyngeal nerve weakness واليوفيلا deviated pointed to usher to the normal side pointed. هذا هو tongue depressor doing the gag reflex. This is gag reflex. وأيضا نشوف اليوفيلا ونشوف البالاتال movement. فالمريض راح يجينا عنده nasal quality speech، عنده regurgitation of food or drinks from the nose، عنده failure of movement of the palatal wall، عندنا uvula is not central والgag reflex is absent or decreased or diminished. The 11th cranial nerve هو accessory nerve. Accessory nerve supply the sternomastoid muscles, high sternomastoid muscles, and the trapezius muscle. So you have to compare the bulk of sternomastoid muscles on each side by making the muscle in action. هاي نعرفها مثل هاي الحركة نسويها. أو you have to compare the power and bulk of upper segment of trapezius on each side by shrinking the shoulder. هاي المانوفر نسميه shrinking the shoulders. نقول له يرفع كتافه لفوق. انت you have tried to prevent from shrinking his shoulders. نشوف هنا ال power of the trapezius muscle، نشوف ايضا هنا ال power والبالك نقدر نلزمها للستيرنوماستويد muscles. فاذا عندنا weakness معناته اكو عندنا accessory nerve involvement or accessory nerve palsy. Hypoglossal nerve is the 12th cranial nerve. It supplies the muscles of the tongue. So you have to inspect the tongue in the buccal cavity, looking for if there is any wasting or any fasciculation. You have to test for tongue movement. So you have to ask the patient to protrude his tongue outside and movement from side to side. The tongue deviate to the weak side, لأن powerful muscles هاي perfect معناتها هذا السايد فيدفع الweak side، فاللسان ينعوج deviate to the weak side. إذن وين هنا عندنا right sided hypoglossal nerve palsy، right sided hypoglossal nerve palsy. This is the hypoglossal nerve. It originates from the medulla oblongata. Now we are finishing examining the cranial nerve. The third step in examination of the patient neurologically هو examination of the motor system and cerebellar and sensory system and cerebellar system. So how we examine the motor system? By examination of the muscle bulk and looking for if there is any fasciculation, abnormality, posture, abnormal movement, and deformity. So you have to inspect the muscles for any abnormality.